Next up will be Octavia Brown. And one of the things I will say is her focus on mental health at the interpersonal level and the familial level did not just begin with the crises. This has been a building and a partnership operation with many of us to be able to deliver services to people where they live and where they currently exist, and do it in a culturally competent manner. And so, Octavia, I know you have a presentation, so we want to begin that. And thank you. Good to see you.
Thank you. All right, I'll try to be as brief as possible for Will gets me. He knows I talk a lot. So let's get this presentation up and running. I'll just say one brief thing about myself. I am a mental health clinician, a social worker who serves as a mental health clinician. And I have dedicated my life and my career to working in low-income urban communities and communities of color. So I'm going to specifically be talking about COVID-19 and how it relates to the Black community and the mental health of the Black community. So we can go to the next slide. Okay, so I just want to focus on 4 specific factors and how they influence of COVID and how they influence the mental health of the Black community. The first thing that I want to talk about is in which a number of our panelists has discussed, and I am so thankful for them bringing that disparities to light, that there is a huge disproportionate number of African Americans contracting and dying from COVID-19. And this absolutely affects the mental health of the Black community in ways such as there will be every person who passes away, every person who dies, that is someone's father, mother, sister, brother. So they have a family and a community of friends who they're leaving behind. And those individuals will have to suffer with the loss and the grief from losing their loved ones. There's also a huge increase in anxiety and depressive symptoms as a result of disproportionate numbers of African Americans and Blacks contracting from this disease. You know, am I going to be next? You know, and as the doctor stated previously, we already know the reasons why there's a disproportionate number. It is because of the healthcare disparities that exist. And so there can be a fear that, okay, if I contract this disease, is this it for me? I mean, this virus, is this it for me? Am I going to die? Am I going to be adequately cared for when I go to the hospital? And so all of these things affect our mental health. Also, job loss and economic impacts, which leads to increase in stress and its related symptoms in the Black community. It pushes Black community members into survival mentality, which we know absolutely impacts their abilities to care for themselves and their loved ones. Social distancing and isolation. The Black community is huge on kinship and family ties, and we are very connected to our community. And so having to socially distance ourselves and isolate ourselves, that's very difficult for us as Black people to do. And since we have such huge emphasis on relationships, isolation can produce feelings of loneliness and a reduced access to social supports. We are huge on depending upon our community and our family for our social support. And so that absolutely affects mental health in the Black community. And then last but not least, I want to touch on the mental health stigma in the Black community and the shortage of clinicians of color. It is important for us to be able to have clinicians who understand the very unique needs that we have as African Americans in this country and how to address that, you know, competently, and we just overall feel more comfortable a lot with being able to sit with an African American clinician. And unfortunately, there is not a huge number of African American clinicians. And then there's a huge mental health stigma in the Black community that we have to face, even if we decide that we want to go and get services. So we can do the next slide. So with all of those problems, I never give people problems without giving solutions. So let's focus on some interventions on a community level, which is all from my people who are working in the community, the advocates that we have out here, those who are on the front lines of working in the Black community. What can I do to help with this issue? So first, you can check in on your community members as often as possible. You want to continue to use your social media platforms to educate and destigmatize mental health in the Black community. One of the great movements I have seen is therapy and Jesus. That is something that we want to keep pushing out there. Jesus creates these therapists for us and use them as resources, so we don't have to, say no to therapy and just yes to Jesus. Jesus wants us to use therapy too. So continuing to use those platforms to educate on mental health and what that looks like. You want to know which agencies are offering mental health services and have clinicians of color on staff. There are 2 agencies that I can speak of right off the bat, which is one that I work at, Thrive Behavioral Health. We have a number of African-American clinicians on staff. They accept medical assistance, and Arundel Lodge also accepts medical assistance and private insurance as well. And then it is very important for community members and leaders to know what to do when someone is experiencing a mental health emergency. If a person is suicidal or experiencing active psychosis, which is delusions or hallucinations and things in that nature, or any other mental health emergency, you want to contact Anne Arundel Crisis Response at 410-768-5522. And if all else fails, you can call 911, but it is very important for you to inform officers that the community member is dealing with a mental health crisis and should be treated as such and not as a criminal. That will be very, very, very damaging to an individual if a police officer goes and does not approach this individual in the correct way as someone who is needing help. The next slide. On an individual level, this is what you can do. Stay in contact with family and loved ones as often as possible. It is very hard for us not being able to be around our loved ones. So call them, FaceTime them, making sure that you're talking to them as often as possible. Know your resources in case of a crisis. If you're having any suicidal thoughts or you're experiencing some very overwhelming mental health emotions or symptoms, the same thing, contact Anne Arundel Crisis Response. If you yourself have to contact 911, make sure that you advocate for yourself. I am a person who is dealing with a mental health illness or symptoms of mental health. Please do not treat me as someone who has broken the law or as a criminal. I need your support. I need your help. Know the signs of mental health illness. If you're having depressive symptoms or anxiety symptoms that are persisting more than 2 weeks, or mood swings that you're really having difficulty controlling, that's when it's time for you to reach out for help. And most importantly, know your community advocates that you can connect with here. You have myself, I'm here. My phone number is listed. You can call me anytime, day or night. We have Tony and William Pratt, Devon Gay, Dee Ward, Amy Cruz, William Rao, Tola. These are just a few people who are very much in the community and are here to help you. Be intentional about engaging and self-care techniques daily. And I'm going to talk just about a couple of those. Go to the next slide. I'm going. Self-care techniques for Black and brown people. Yes, we are different. The way that we self-care is different. So I just want to touch on, despite the fact that we are strong and super resilient people, from everything that we have encountered in this country, as far as slavery, Jim Crow, police brutality. There's a whole nother slew of information that we just received from an individual who was Black and running in the community and got shot and killed. That stuff affects us. And even though we are so strong and resilient and we hear these stories over and over again, or it happens to, our family members, or we've been, victims of discrimination, we have to get rid of the idea that we can just pick it up and keep it moving. We have to take care of ourselves. And so we must learn to not only survive, but to thrive. So simple things such as eliminating toxic energy and people from around you, practicing yoga or meditation, burning sage or other aromatherapy oils. These are perfect ways to engage in self-care, and absolutely, talking to people who understand what it is that we go through as African Americans can help you as well. Next slide. And last but not least, I just want to repost these resources. Thrive Behavioral Health, they accept medical assistance. We have clinicians of colors on staff. I work there. I work very hard to make sure that we are culturally competently trained and we know how to work in the urban and Black community. Arundel Lodge as well. I have a relationship with the director there. And then, of course, I have a social work YouTube channel. I put out a lot of videos educating and empowering the Black community and on mental health. So subscribe to the Urban Social Worker and you can get much more information. That's longer than 3 minutes. So I'm done.
Oh, well, that was time well spent, honestly. And because information is power. Information is power, and I want to thank you for that. I think we all thank you for that. That was comprehensive and not tedious at all. So thank you. Thank you very much. And we will loop back with you because this is all about resources. And this is a native Annapolitan who just gave that presentation and is serving her community. So thank you so much. I also want to, while we're on this subject,